Thank you everyone for joining us, and welcome to our weekly media briefing and public health update with Montgomery County Executive Mark Elrich. I'm Lorna Virgili, Hispanic Public Information Officer, and joining us today is Dr. Keisha Davis, the county's health officer, Dr. James Bridgers, who is the Director of the Department of Health and Human Services, Monique Sanfuentes, Administrative Director of Community Affairs and Population Health at Suburban Hospital, Johns Hopkins Medicine, Dr. Earl Stoddard, who is Assistant Chief Administrative Officer, as well as Luisa Cardona, Assistant Chief Administrative Officer. And our special guest this afternoon is Abel Nunez, Executive Director from the Central American Resource Center, known as CARECEN. Thank you, everyone, for joining us. Mr. County Executive, go ahead. The floor is yours.
Thank you all for being here, and I think you're going to get introduced to a couple of interesting guests today. I'm joining you later than usual from our Annapolis office because I'm down here for the opening of the 2026 Maryland General Assembly session. And it's always exciting to be here for opening day, and I share my thoughts with our elected leaders, how we can improve and move Montgomery County forward. Let's be honest, there is not going to be any blank check to meet all our needs. But that doesn't mean we're going to allow the federal government to dictate how we operate our county or our state. We're leaning on state leaders to be creative and bold in developing new revenue sources to help us address our transportation needs and continue the groundwork for bolstering economic development. These are things you just can't walk away from, even in tough times, because building a future, that task doesn't change just because you're in tough times. That work is out there. It needs to be done if we expect things to go in a better way, which I think all of us want things to do. Our economy has not grown as quickly as the pandemic. Coming out of the pandemic as our neighbors, and there are reasons for that are rooted in decisions previously made not to invest in infrastructure, the opposite path that Northern Virginia adopted in 2013. And it's a path that we can still follow now if we choose to. Our county has long led the way in building unity, compassion, and rallying behind those in need. That can be seen through our Office of Food Systems Resilience and the launch of the next phase of the Food Recovery Network strategy. We're not shrinking away from the growing need in our community for better collaboration to address hunger. You can see that in the compassion on display at the Federal Workforce Career Center. There are literally thousands of former workers and contractors who are finding a path forward with the help of private businesses and community partners coming together to help find solutions to this crisis. I believe our state lawmakers will move us forward as well. They know as well as we do how important Montgomery County is to the state, particularly as an economic engine. Our success benefits all of Maryland, all Marylanders. So here's to a successful General Assembly session. And yet another stunning and unbelievable move, you can guess that I'm talking about Donald Trump. The Substance Abuse and Mental Health Services Administration, the agency that oversees mental health and addiction treatment, announced yesterday that they're sending hundreds of termination letters effective immediately for federal grants supporting mental health services. I haven't seen official information, but news sources say the cuts are to nonprofit groups, some of which provide street-level care to those experiencing addiction, homelessness, and mental illness. The amount of the cuts could be as much as $2 billion. His whole philosophy behind this is if you cut people off from services, I guess face them with starvation and provide them no mental health support, that somehow they'll straighten themselves up, get jobs, and go rent apartments. That's pretty delusory, but it's not a surprise coming from him. In what world does cutting services to those who are most vulnerable make any sense? Couple that with what he's already doing to the system of services for people experiencing homelessness, and there's no other way to think about this than this president is a cruel human being and suffering from mental illness himself. The recurring theme of we're going to hurt people, and that he's blatant in targeting blue states for inflicting the most pain, is unforgivable for a president of all the American people. That would be like me cutting services to Republican parts of the county, something I would never conceive of doing. We're all in this together. And when you're in the government, you serve everybody in your county, not just the people who voted for you. We're also living in a nation under his rule where civil liberties are being eroded and the free press is being attacked and shut down when they can get away with it. They're defunding scientific research, destroying healthcare, embarking on totally racist policies, that seek to roll back the gains of the civil rights movement, and so much more. I think this morning's specialty was that America needs to get rid of all third world immigrants, just period, needs to get rid of all these people. Stunning. Whether it's about science, climate regulations, the federal workforce, DEI, or immigrants, we're being led by a man who's a fascist, a racist, an authoritarian, and most concerningly, he's a nihilist. Regardless of political affiliation, presidents have historically provided solace and comfort during times of tragedy and turmoil. However, this president and his supporters seem to want to exacerbate all of this. Glaring example is the administration's response to the recent murder of Renee Good. As the little thing up on the screen, showing now is his latest justification was she was highly disrespectful. I guess it's just, if somebody's highly disrespectful, you should just shoot them. I mean, of course, that's a logical thing to do. And that's what you expect out of your law enforcement officers. On what planet that's true, I'm not sure. But the idea that the President of the United States thinks that's an excuse for murdering somebody, this is what thugs do. It's not what leaders do. The president labeled Mrs. Good a criminal and a domestic terrorist, which is quite ironic given that he pardoned hundreds of January 6th insurrectionists who attacked law enforcement, killed law enforcement in 2021 with the support of the president. What is most frightening is the lack of unified response to the shooting and the total lies told by Trump. I watched the video. I'm sure many of you did. At no point did the victim run over the ICE agent. Yet Donald Trump, to justify the murder, also said that she ran over the ICE agent, repeated it. Any fool can see that the agent was not run over, wasn't even hit, as the driver attempted to turn to the side and drive away. It's one thing to be mad about a demonstration. Maybe, nobody's comfortable being demonstrated against. But it's quite another thing, and quite an evil thing, to say that Renee Good ran over an ICE agent. If you haven't seen the video, you should. If you don't know who to believe, watch the video. If you watch the video and think you watched the ICE agent get run over, either get your eyes examined or stop hallucinating. But you need to do something about your mental health. The idea that the president can lie with impunity about something that is visibly false and that so many people have seen and can't bring themselves to say that this is a bridge too far is a sad commentary on the state of this society. It's hard for me to believe that every single member of Congress isn't outraged by this act and doesn't think to themselves, what would happen if this kind of logic was applied to them? I think they'd be screaming unjustness and unconstitutional. Odd that they don't feel that way when it happens to someone else. And if the president thinks killing protesters in Iran is an unacceptable evil, then he needs to acknowledge that it's evil when it happens in America. There aren't two different standards for evil. These kind of events reach across the globe, and especially in Montgomery County, because we are so diverse. Yesterday's council meeting helped raise awareness about the concerns and fears of the immigrant community as the Trust Act legislation was introduced. I'm proud to have Abel Nunez, Executive Director from Central American Resource Center, joining me today to talk more about what advocates are seeing and how the nation's immigration policies are negatively impacting communities everywhere. Thank you for being here, Abel.
Thank you, County Executive, for having me here. It's a real pleasure. It's to not only work with you, but work with the county to ensure that we're providing additional services to our immigrant population. Carecen is an organization that was created over 45 years ago by the incoming flow of Central Americans, at that time fleeing civil unrest in the region. But they made the DC area their home. And throughout the 40 years that we've been here in large numbers, I think we've been an asset to this community, to the county, to the state. We are definitely, a huge part of our workforce and labor sectors that are needed for our vitality. I think we bring not only our labor, but our culture, and all the gifts that come along, and just on a larger point, most studies show that immigrants are a blessing to the place where they end up living. They revitalize economically, culturally, and so I think that it behooves us to make sure that the local government actually provides the services to make them be more successful. Now, having said that, unfortunately, the political leadership at the federal level has not always done the right thing. And unfortunately, it has been up to local municipal governments, county governments, to take up the slack because Congress has been unable to pass immigration reform that, one, works best and strengthens our nation, protects our immigrants, and ensure that local communities thrive. I think that, again, local municipal governments are providing services, are ensuring that people feel welcome in their new home. Montgomery County is a leader in that. But for a year now, our community has been facing an incredible threat from the federal government. We have become, according to our current president, murderers, thugs, people that are not welcome in this country. And in the way that he's enforcing immigration reform is very cruel and specifically done to threaten people, to scare people so that they will leave. What he doesn't understand it is that the fate of our nation, Maryland, Montgomery County, is tied to immigrants. The ability for us to continue to thrive in our local communities, to make sure there is a process by which people can still continue to come in, because that hunger that immigrants bring help us get better. The diversity that we bring makes us stronger. And so to that extent, I am happy that we're partnering to ensure that Montgomery County immigrant residents receive the services. Now for over 2 years, we've been partnering with the county to serve Haitians, African immigrants, and of course, Latino immigrants as they're trying to navigate an ever complicated immigration system. And you have a federal government that is trying to eliminate all avenues of relief. They want to cancel humanitarian programs such as TPS, making it very difficult for people to apply for visas when they're victims of crime or victims of trafficking or victims of domestic violence. Those are vital so that our community feels welcome and contribute to the safety for our overall health. What we're seeing now is that people are scared. What President Trump has done, that he has muddied the waters. He has put forth immigration enforcement, whether it's Border Patrol or ICE, to patrol our streets without having any training on how to patrol in urban centers. Very threatening, mask covered. This really, in our history, in our country's history, goes back to when we had the slave catchers, that those were government approved posses with incredible authority checking people's papers. So it's very similar. Unfortunately, it's part of our past, but it doesn't have to be our future. And I think if we work together, I think we can create a space here in Montgomery County where people thrive. And we have to do the work to make sure that people trust. Again, unfortunately, it's very nuanced for our community to understand the difference between a federal agent, a county officer, or a local town officer. And so who ends up dealing with the consequences of this enforcement will be local community governments. It'll be our school system. It'll be our neighborhoods. And so to the extent that we can do that and put in not only programs, but policies that send a signal to our community that you are welcome, that you are protected, it would allow our community to once again be able to breathe in a very complicated place. Unfortunately, we still have 3 years of this administration, and as we have seen, they have incredible authority to cancel programs, to set forth the priorities for enforcement, and even the type of enforcement. What we've been seeing, not just in Minneapolis, but across the country, prior to the tragedy that happened in Minneapolis, there were over 50 people that had died in the hands of ICE in their detention centers. And so we're beginning to see that this is not just an attack of immigrants, but is an attack on our democracy. It is an attack on people that do not share the president's worldview. And they're going to make anyone that wants to partner, wants to protect our community, a target. And so to the extent that we can work together, create that network so that people feel safe, that they can come, not just to organizations like Aresen, but to county employees, government employees and to understand and know that they will be protected is incredibly important as people try to live, send their kids to school, go to their churches, and continue to live their daily lives that in the end strengthens the county and by extension, the state of Maryland. So once again, I want to thank you for all the support that you're providing the immigrant community. I want to thank for the policies such as the Trust Act that really lays out what local police can and cannot do as it relates to immigration. And in this in no way means that our local police will somehow arrest ICE or prevent them from doing their duty. What it does say is that there is an understanding of what the role of county police is and what the role of immigration enforcement is, and that to the extent possible, they will not assist in any of that. That the world of the federal government is the world of the federal government, and the world of the county life and county safety is that. And so that if we can ensure that our community understands that, we can prepare them for what's ahead. We have some difficult times coming in the next still 3 years of this administration. But I think if we continue to work together, we'll prepare our community to best survive the onslaught of attacks from the federal government and together build a stronger Montgomery County. So thank you very much for having me here.
Thank you, Mr. Nunez, for joining us this afternoon. Members of the media, do you have any questions for Mr. Nunez at this time? Please raise your hands. No questions related to this topic? Okay. Mr. Nunez, thank you so much for joining us this afternoon. You can remain on this call or you can depart if you need to. Thank you.
Thank you for joining us. I want to talk a little bit more about immigrant resources. The Gilchrist Immigrant Resource Center is in Montgomery County to offer reliable information, legal referrals, and language assistance and support. And it helps residents protect themselves and their families. And I encourage you to highlight these resources to help our immigrant community as you cover this story. You can find them at montgomerycountymd.gov/Gilchrist, GILCHRIST. After years of delay, on another happy note of progress, I think, last summer, the Viva White Oak project was announced with MCB Development, and it will launch the most significant development in the history of the East County. This week, the council held the public hearing for the tax increment financing, or TIF, that we're proposing for the Viva White Oak Development District. The TIF is crucial for the additional infrastructure to support the development of nearly 300 acres of land for this project, land which in its current state is basically sand and gravel pits. At full build-out, it's going to create more than 9,000 permanent jobs and an estimated $62 million in annual revenue for the county. Without this kind of support from the county government, no developer has the means or incentive to commit to such a large project that will create this level of housing, jobs, and a new center for commerce in our county. It's the kind of project that comes around once in a generation and is a result of creative problem solving. We worked hard to put this deal together. We have to establish special funds that are dedicated specifically to this project. It takes bold steps to stimulate intensive economic growth and community investment in cooperation with a private sector developer like MCB Real Estate. The revenues from the special taxing district will go to build the infrastructure. So general funds, general tax revenues are largely not part of this deal. These are taxes that otherwise we would not be getting were it not for the development. I'm going to continue to champion this project and hope to see it advance quickly for approval. On January 15th, we have the healthcare exchange enrollment deadline. That's tomorrow. There have been a lot of healthcare changes to keep up with, and this is a big one. Tomorrow's the deadline for signing up for the Maryland Health Connection. It is the state's official insurance marketplace and a resource for those who are out of work or uninsured. The health exchange can also help those who lost federal health coverage at the start of the new year due to changes in eligibility requirements. Participation requires proof of Maryland residency and U.S. citizenship. I'm sharing a link to the Maryland Health Connection website in the chat of this Zoom call. So please let your readers know about this. A priority for my administration is to ensure that every county resident has access to health care. Our community partners and our public health professionals help provide services to tens of thousands of county residents who aren't covered by insurance. We don't want to see these numbers grow because it puts their lives at risk. I encourage you to send your audience to marylandhealthconnection.gov by tomorrow night to determine if they qualify for Medicaid or can benefit in other ways from the program. On Monday, I got an update from the Community Health Improvement Plan, or CHIP. We've been working for months with hospital leaders to study how to improve our healthcare system. I want to thank Adventist Healthcare, Holy Cross Health, MedStar, Montgomery, and Suburban Hospital for their work hand in hand with the county and all of our nonprofit partners to develop these suggestions to the CHIP program. Today, my health team has invited Monique Cienfuentes, who is the Administrative Director of Community Affairs and Population Health at Suburban Hospital, to join us to discuss CHIP. So I'll let them take it away and before we ask your questions.
Thank you, Mr. County Executive. We were excited on this past Monday to bring together folks from the health department, from other county government agencies, nonprofit organizations, and our hospitals to kick off our community health improvement plan. This is a plan that the hospitals and the health department have done independently for many, many years. And this is the first time that we are doing it collectively together, which marks a new, deeper partnership between the health department and the hospitals. We care for the same people. We all want them to be healthy, and we all want them to be in the emergency room less. And so I will turn it over to Monique Cienfuentes, who was one of our key partners at the event on Monday, to talk a little bit about the initiative.
Thank you, Dr. Davis, and many thanks to you, Mr. County Executive, for inviting us. And I say us because I am hopeful to represent a voice of many in this partnership. And similar to what Dr. Davis mentioned, the Community Health Improvement Plan is important because it gives us a shared roadmap at a time when health challenges are more complex and interconnected more than ever. It brings together community voices, public health expertise, healthcare organizations, and local leadership around the same priorities, so we're not working in silos. Partnership with the health department is essential. Public health brings a public level lens, trusted community relationships, and data. Healthcare organizations bring clinical insight, some of that data, community investments, and a direct connection to care. So when those pieces come together, we can move upstream, focusing more on prevention and access and equity before people need that acute care. This plan was built through a year-long process in this new partnership of coming together with our health department. These collaborations have been moving together for many, many years. And the process included lots of listening, analyzing data, and refining many priorities with partners and residents. The intentional approach is what makes this plan actionable. And for residents, this means very deliberate coordinated services, reducing gaps and increasing investments aligned with what the community has told us that matters most to them. It's about making health support easier to access and more responsive. So our CHIP, Community Health Improvement Plan, is definitely not the finish line. It's a commitment to action. Healthcare organizations remain fully engaged partners, working alongside our amazing Montgomery County Health Department and county leadership to turn this plan into measurable improvements in community health and well-being. And we are just overly excited to be able, again, to continue this work and listen to our community partners as this initiative continues to evolve and we grow it over our lifetime.
Thank you.
Thank you so much, Monique. Just to share the three priority areas that we are going to collaborating on. One is easy access to comprehensive care, maintaining that all residents deserve access to high quality, culturally, linguistic, and responsive care. Secondly, the promotion of healthy living and well-being, that communities thrive when people are supported to live well. And third, support for essential community services, that our environments shape our health, safe spaces, and responsive services help communities to thrive. So we are so excited for this partnership. Just want to turn our attention a little bit to talk about respiratory illnesses. We couldn't get off one of these calls without talking about flu, COVID, and RSV. We know that all of them are, there's a lot of respiratory illnesses in the air. You probably know somebody who is sick right now. Flu, again, has been a record high flu year. It looks like maybe we are starting to see the peak of flu and turning the curve. Those numbers look to have plateaued just a little bit in this week. But at the same time, we are starting to see RSV is continuing to increase, and COVID, which had been low, is starting to increase as well. So take precautions. If you are sick, remember the best thing that you can do is stay home and not spread those germs to other people. If you have to be out and you're sick, you should stay home at least till you're fever free. But if you have to be out, to wear a mask to prevent the spread. Masking in public places can be helpful to prevent the spread to others, doing things like washing your hands and covering your cough, but most importantly, staying home if you're sick. In our hospitals and healthcare facilities, they are continuing to recommend source masking, which means for people who are sick to wear a mask. So if you are in an emergency department or in a hospital or in a healthcare facility, including our own healthcare facilities, within the county, you may be asked to wear a mask. That is a recommendation, though not a requirement. We do strongly encourage that. It is not too late to get a vaccine. We still recommend them. The county does have resources for uninsured children as well as uninsured adults to get COVID, flu, and other vaccines. This is the first year that we have been able to offer those vaccines to uninsured adults. We've been able to offer them for kids in the past, but we are excited to be able to expand that a little bit. And you can call our health department to be able to access that if you need to set up an appointment. With that, I will turn it over to Dr. Bridgers.
Thank you, Dr. Davis. And I just want to commend you and the county executive and our hospital partners. Good afternoon, Ms. Sanfuentes. This is something that we talked about as part of your Health and All policy initiative and bringing this to fruition. It took us about a year. The county executive, charged us with that, and we were able to pull it together, and we're making great strides with that. I wanted to thank you and the team for doing that. And that's it. I'll turn it over to Dr. Stoddard for his updates and or comments.
Good afternoon. I only just have a couple pieces. Number one, the county is aware of the Verizon interruption that is occurring across the country, and it is affecting some of the calls into our ECC. So our Office of Emergency Management has put out guidance around how to respond to that. Obviously, the landline being the most convenient way to get into our emergency communication center should you need to. We are obviously working with Verizon and this is not just affecting Montgomery County, nor is it affecting only our emergency communication center, but we are working closely with the provider to address the issue as quickly as possible to get service restored. But it's important that we get the message out there that, if you attempt to call the 911 center, for example, and are unable to get through, it may be because you have a Verizon device and not because of an issue at our call center itself. I also want to take a moment to recognize Commander Jason Kokinos, who was last Friday's hometown hero for Congressman Raskin. And if you can see on the video, Jason was the on-scene commander for the 50 or so Montgomery County Police Department responders who went down to the Capitol on January 6th of 2021. And Jason describes what the situation that they encountered when they went to the Capitol building that day. They were the first responding units to arrive besides the district police officers and the Capitol Police. And they do come with their community emergency response team, which includes, the ballistic protection and things like that to deal with civil unrest. And so they were the best equipped unit that was there early on. And Commander Kokinos does a really good job of describing the violence that they faced and the situations that they had to encounter, and the fact that there's still at least one officer from the Montgomery County Police Department who is unable to return to work as a result of injuries sustained on January 6, 2021. And so just wanted to recognize him for the recognition he received on behalf of the entire team that went down to the Capitol building 5 years ago last week. And so I think that's all I wanted to cover for today, and thank you very much.
Thank you, everyone. Members of the media, do you have any questions for the county executive and or the team today? I see Ms. Hackerby. Go ahead, but that's up today.
Hello. I had a question about a release that we received from McGeo yesterday for the county executive. Apparently, there was an incident on December 15th in Rockville where the union says that some crisis workers encountered a violent situation and police were not dispatched. I just wanted to see if the county executive is aware of this, if he has any reaction and any sort of response from the county.
I'm aware of it. I'll let, I think, is this Earl's going to take this one?
Monica Martin, our chief for behavioral health and crisis services, is on, and she can speak to the situation.
Yes, yeah, absolutely. We're aware of the situation. We have been communicating and collaborating with McGeo since the day that incident took place. We've obviously done a thorough review of the incident and obviously are not at liberty to share details of many aspects of the incident because behavioral health services are protected under state and federal regulations in terms of sharing details. But in terms of our review, we have found that everyone involved was following our common triage and dispatch protocol, which provides the guidance for when law enforcement accompanies an MCOT response and when they do not. This was a situation in which from the very beginning, it was identified that law enforcement would accompany the MCOT response. And the MCOT team was awaiting that law enforcement arrival. Unfortunately, there was a situation where an individual in distress, came out of the residence while that MCOT team was awaiting that arrival and was in acute distress and did continue to engage in violent behavior. But we've done a thorough review. We're finishing our review. We have an incident review committee that looks at every aspect of this, and we're confident in our safety precautions and protocols, and we'll continue to refine and update them and learn from these experiences. I do want to highlight and add that we have an increasing number of civilian-led responses that we have been able to perform through our mobile crisis and outreach teams over the last 2 years. We're up to 7 teams operating at any given time. And we have thousands of these responses per year at this point in time. And we have never had a safety incident where any staff member was injured in this response, including in this particular incident. Although, of course, the circumstances are such that we take this review very seriously.
Gotcha. And is that review the results of it, will it be made public once it's concluded?
So our critical incident reviews, MPIA requests are always welcome around those reviews. But we are following through with making sure we do a debrief with the full crisis center team first, and that we respond to the McGeo grievance. But actually, if there's any questions around the policies and procedures that guide the operations of our MCOT teams, you're welcome to submit a request.
Shelley, for your benefit, I think it would be good for just to take a moment to explain sort of the way our system in Montgomery County works with regard to the so essentially, we have 3 different types of responses that our behavioral health response could take. Number one, we have a civilian-only response where there's no risk of violence. There's a joint response between where a clinician and a police officer will be dispatched jointly. And then there are situations where there's the highest risk of violence, or there's ongoing violence where the police will respond as the lead agency and may be supported on the back end by the therapists or social workers, but they're taking the lead because of the risk of violence. And obviously, the same is true in a medical situation, obviously, where there's risks of violence. Our EMS responders will often stage until our police department is able to go and make the scene secure. And so as we review these things, we constantly are trying to improve our situations where we take our responsibility to keep our employees very seriously. It's one of the most critical things that we in the management of the county have to do. And so obviously as we would in a situation involving our EMS responders where there's been situations where they've been exposed to risk of assault and other things of that nature. We always review these situations. This situation is no different than those, but that doesn't mean it's in any way minimalized. This is obviously, as Division Chief Martin referred to, this is the first time we've actually experienced a situation like this with our MCOT responders. So it's an opportunity for us to learn and see if we can improve. but obviously this is not unusual given we have civilian responders in other situations where there can be violence on a scene.
Thanks.
Thank you, everyone. Members of the media, any additional questions? No more questions? Well, thank you for joining us this afternoon. Stay safe, and we'll see you next time. Have a great afternoon.
Thank you all.